Today in the series of Doc Plexus KOL interviews, we have with us Dr. Shailesh Hadgaonkar, who is a spine surgeon working at Sancheti Hospital. Thank you, doctor, for being with us.
Thank you. Thank you for inviting us for this show.
Shall we start with the interview?
Yes, please.
So we are going to talk about spinal tumors, starting with the questions. What are the different types of spinal tumors firstly?
Yeah, spinal tumors, there are various different types. We know spine as a supporting structure to our back, and there are bone and nerves and soft tissues. So there are different tumors which we see. We see intradural spinal tumors which are inside the spinal nerve and spinal canal. We see the tumors which are outside the nerve sheath and they are into the bony integration, which causes a lot of destructive elements and significant pain. So they are the bony spinal tumors. These are the main two different types which we should know as a general population, and the tumors which are inside bone are soft tumors, but they can cause hazardous elements like weakness in the lower limbs, power difficulty, and the bone tumor causes destruction and instability.
Thank you for letting us know this. Moving forward, what are the basic causes of spinal tumors?
I think there is it's not that this is the reason which is causing spinal tumor. It's still unclear, but commonly we see genetic preponderance is quite high in spinal tumor. There is family association, or it normally is considered genetic mutations which leads to this. A lot of chemicals and industrial things also can contribute to spinal tumor, where you're working and this chemical tumors, but we can't say this is the only reason for this particular type of tumor.
Okay, so what are the uncommon or surprise findings in spinal pathology?
No, normally patient comes to the clinic and he complains of neck pain or back pain, and we, like routine doctors, we always talk about medications, physiotherapy, giving some exercises and yoga. But when the patient complains this, it persistently complains of back pain and is not getting better, we have to suspect. Suspicion is very important when someone is not getting better. A lot of time we need to check whether the patient is losing weight, is there is a difficulty in walking, is there is a difficulty in movement of the hand or legs, is he getting tingling in the legs or tingling in the hand, what's happening. It is very important. Clinical correlation is important, and if we suspect something, then there can be a surprise. Like we have a lot of patients with infection, spinal cancer, tumor, what we say, which is not expected by anyone, but they are there, and then we have to deal with it.
Talking about spinal cancers, I would like to know what is the reaction of the patient or the family members when they get to know that they have been diagnosed with cancer.
Yeah, we all know cancer is a very dreaded word, and when we hear that there is a cancer, we lose 50% of our life. We say, oh my goodness, I am not going to get better. And spine and cancer, again, spine is a lot of myths are there. People feel there is a spinal problem, I am not going to get better at all. And spine, I have a tumor or a lesion or a cancer in spine, means I am almost not going to survive. It's not the fact. They get scared. We have to have very good awareness that there are a lot of tumors where we can deal with it. We can do very good proper treatment. We need to analyze which type of tumor it is, what really we can do. There are a lot of advances which have happened in chemotherapy and radiotherapy, where people are doing significantly better, and long way to go. Rather than pay, most important, I always feel that we have to have that clear vision and awareness in public and in population that spinal cancer or spinal tumor can be curable. We can treat to the best possible abilities of us. We have advances in spinal treatment, cancer treatment, and there is a lot of hopes in future.
Okay, moving forward, can you please enlighten our community regarding the various treatment options related to spinal tumors?
Yeah, as I said, if there are very few percentage of tumor which are very rapidly progressing and the chances of them deteriorating is very high, but I would say 90% of the tumors we can give a good quality of life to the patient. There are two main types of tumor, I can say that. One is a benign, benign is not troubling to anyone, and malignant, which is rapidly progressing. So if the tumors are benign, we have to be planned properly whether it is causing any destruction, instability, and do that job. And then if needed, we can do radiotherapy or whatever medical management. Oncologist plays a big role in spinal tumor treatment. And if it's a malignant, then we need to assess what it is, what type this tumor is. Biopsy of that spinal infection tumor is very, very important, which tells us subtypes and the treatment protocols. Surgery is always a last option when there is a destruction, there is instability, spinal nerve compression, and weakness in the limbs, lower limbs or the upper limbs.
So what are the various surgeries done for treating spinal tumors?
Yeah, I would say we do most of the surgeries nowadays starting from the neck to the mid back to the lower back, and they are called as reconstruction surgeries, where we remove that portion of the tumor. We reconstruct with some kind of cages, mesh cages like titanium cage and screws and plates, where we can give that additional stability to the patient to have activities of daily living.
That was quite insightful.
Yeah.
Lastly, would you like to give some message to our community?
Definitely, yes. I would like to tell that if there is a problem, there is a pain in the neck or back, and if you are not getting better, definitely visit a specialist. Do not ignore your symptoms. If your pain is persistent, if you're having weight loss, if you have difficulty in walking, you're getting tingling numbness in the hand or lower limb sciatica type of pain, it can be anything. Chances of you having spinal cancer are very, very less, but do not ignore it. Ideal is a specialist diagnosis and treatment. You will definitely have a better quality of life.
Thank you so much, doctor, for being with us. That was a great discussion.
Thank you.
Thank you.
Thank you.